So yeah, I'm at the doctor right now, and I should be done probably like in 20 minutes, I would think, and then I can meet you. Does that sound good? All right. Okay, they're knocking. I gotta go. Okay, bye. Come in.
Good morning, CeCe.
Hi.
I'm Marilyn. I'm the
Marilyn.
public health nurse that's
Hi,
going to
nice
see
to
you
meet
today.
you.
So, what brings you in today?
Well, I just need a routine pelvic exam for
Okay.
I like to get this done right around my birthday every year, and it's time.
Good for you.
So
you're
that way I don't
tying
forget.
it. Yeah. You're tying it to some other important event in your life.
That's
Good
right.
for you. Good for you. So, tell me how old you are.
I'm 43.
Okay.
Almost.
Okay.
Next birthday is like in a week.
You're one of those people who
I'm
thinks
actually
to
42.
the next age.
43.
Yeah. You turn one age and you're already the next in your mind.
Yeah.
Okay, so one of the things I ask women when they come in for these kinds of visits is, what are your periods like? When was your last period? And
they're a little irregular, but you know, I'm kind of getting to that age where, so I have them most months, but every once in a while, you know, it'll be like three weeks longer than normal.
Okay.
They always start again.
And do you remember when the last one was? When the last one started?
I just finished my period last week.
Okay, and that's how you remembered to come for your appointment?
Yep.
Okay, what day was it?
The day of the month? Well, it was last Tuesday is when I finished.
Okay, so that was the 17th. I think that was the 17th.
Okay.
And do you have any kinds of issues with your periods? Are you having cramps? Are you having like heavier bleeding or changes in bleeding patterns?
It seems to be a little bit less than it had been during my younger years, but nothing real radically different yet.
Okay. And do you have anything that you use for birth control?
No. I don't need it. I have one of those tipped uteruses.
Okay.
And I mean, I'm 43 and I've been active for, over 20 years, and I've never been pregnant, and I don't think I can get pregnant basically, and
So
which is okay.
So wait, back up a second.
Okay.
So you're telling me you've had sex regularly for 20 years?
Yes.
And never had a pregnancy?
No.
And never used birth control in those 20 years?
A condom. Like I haven't had an IUD or any of those shots.
Okay.
I mean, I definitely use condoms.
Okay.
But,
And
if you're
tell-
trying not to get pregnant, that may not be the best way to keep a pregnancy from happening.
Well, that's pretty good. At least you know that condoms are one of the methods that maybe don't have as high a rate of effectiveness as some of the other things.
But, with that tipped uterus, I mean, I've been told that the chances of me getting pregnant are so slim anyway that it's really not a concern. So.
Okay. All right. And tell me about partners. What's your partner situation right now?
Well, I'm not in a committed, romantic relationship necessarily. I, live with my best friend, and we've lived together for a while now, 8 years, and
And is this a male partner? Or
it is a male partner, yes.
Okay.
And I mean, we're definitely involved sexually, but it's kind of like a friend, like a best friend thing. It's not really, so, occasionally he'll have dates with other people, occasionally I will, but it's just a kind of a steady friendship type of a thing. So.
Okay. And so it sounds like maybe you're having sex with more than one partner.
It's rare, but yes, it does happen occasionally.
Okay. And then are you also using condoms when you're with all of these partners, some of the partners?
With any new person, for sure. I don't with
Your
usually
partner
with
you're
my
living with.
Yeah.
Okay. And so as I go through several questions related to this visit, one of the things I check with women about is just how they're using alcohol. And so I want to go through some of those questions with you today.
Absolutely.
In a typical week, how many drinks do you have that might contain alcohol?
In a week, well, probably three times a week, maybe.
Okay. And how much alcohol do you drink at that one time that you're
just
drinking?
a glass of wine. It's usually a wine in the evening with dinner, or maybe before bed occasionally. But so I've got those big wine glasses, but I never fill them. Just maybe halfway up or so.
Okay. All right. So a half of a large glass of wine, maybe 3 nights a week. Does that sound right?
And 3 nights would be tops, too.
Okay.
It's probably a little bit more normal.
Okay. All right. In the past 90 days, how many times have you had more than 3 drinks on one occasion?
90 days? Maybe once. Maybe once, twice, the most.
Okay.
That's 3 months, so yeah.
Okay. How many drinks does it take to make you feel high?
At least 2. Again, depends on what I'm drinking, but I'm not too adventurous with my drinking, so.
Okay. Have people annoyed you by criticizing your drinking?
No.
Okay. And have you felt you ought to cut down on your drinking?
No, I haven't really.
Okay. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover?
Oh, no.
Sounds like that hasn't been an issue for you
No.
at all. Okay. Are you familiar with what the recommendations are for women and their drinking, and what would be defined as lower risk drinking and what a binge level of drinking would be for a woman?
Well, I know I have friends who are definitely out of range, but
Okay.
I don't know what's considered.
Well, the level of drinking
Recommended.
you're doing is definitely in the lower risk range. So what we tell women is that 1 or less alcoholic drink per day, so about 7 or less per week, is considered lower risk drinking.
Okay.
So one of the things that I tell women is that binge level drinking for women is less than it would be for men. And so if we drink 3 or more drinks on one occasion, which is defined as maybe over about 2 hours time, that's defined as a binge for us.
Okay.
And
Just 3.
3.
Okay.
Exactly. And so depending on what the unit or the glasses you're using, you may have, if you have a giant wine glass, you may be drinking 3 glasses, 3 glasses in that one glass.
Okay.
Because the volume is 5 ounces of wine
Sure.
per serving.
Okay.
You said you had some friends that are using alcohol in a way that's of concern?
I do.
So one of the things you might think about as a friend is just give them a little bit of information about what healthier drinking might look like.
Yeah,
And
they're so defensive. Anytime I've tried to, even just suggest, that they stop, they just get really irritated with me. So
yeah.
I don't want to lose a friendship.
You
so
want to be
I don't
their
say-
friend
yeah.
and not,
Yeah.
Have you ever thought about a way to, have you ever considered doing, if you have a friend that's drinking a significant amount, have you ever done something like being their designated driver?
Oh, yeah. I've driven quite a few times. yeah.
Okay, good. And then the other thing I just want to give you is information about what we know is a, 1 dose of alcohol, for example. So if you're a wine drinker, unfortunately, the amount of wine that we're talking about is like 5 ounces. And when you pour 5 ounces of wine into one of those
That's
big
like half
glasses,
almost like half a measuring cup. Yeah.
When you pour
It's not
it
very
into one of
much.
those big glasses, it doesn't look like much.
Yeah.
So one of the strategies that work for some of us is use a smaller glass.
Yeah, that makes sense.
If the psychology of making it look like it's a
Sure.
little bit more volume, sometimes that helps. But in terms of your alcohol use, I think that you're doing a really responsible thing. So back to your periods. So one of the things that you're also experiencing is what I would call perimenopause.
Okay.
So we're all different in terms of how our biological clock is ticking and what's going to happen in terms of when we're going to stop having cycles. But the fact that you're having some periods that are getting longer between, when they're happening, that tells me that probably you're getting some cycles where you don't release an egg necessarily. But I can't tell you that you wouldn't necessarily have the option of becoming pregnant. And so I would like you to just pay attention to making sure you're using condoms with all of your partners or something to protect yourself. And try to time the alcohol use to times of your monthly cycle that are maybe the front end of the cycle.
Why is that?
Before you might have ovulated, for example.
Oh.
So,
but really, it's been this long. I can't see it happening now.
It may not, but I've had women in your age range who finally something works, or they have a different partner or something, and they have a little surprise.
You're kidding.
No.
Even after 40?
Yeah. I've
Okay.
had that happen. I've seen that happen.
We don't
So
have that
anyway,
happen.
just to be aware of that.
Okay.
Okay, so let's move on and get your exam done.